Thank you for joining me to learn more about mindfulness, research, and best practices. I'm Kimberlee Bethany Bonura. You can learn more about me and my work on the web at drkimberleebonura.com, chairyoga.com, and pelvicyoga.com. You can find me on Facebook at Dr. Kimberlee Bonura and on Twitter at Dr. K. Bonura Yoga. If you want to stay updated for when I post new videos, then like this video and subscribe to my channel. By continuing with the video, you, the viewer, are agreeing to and accepting the terms of the provided waiver of liability.
We began our course with a discussion of self-care as an ethical obligation. We moved then to consider mindfulness and how you can use mindfulness practices as part of your self-care. Now, to set you up for success, let's work together to set your self-care goals. Remember that overall, self-care is an essential component of your professional identity. Pope and Vasquez have identified several common issues and concerns that you might want to address with self-care. These include isolation, monotony, fatigue, having a sedentary life, having a dispirited life, having an unsupported life, neglected health, the distressed or stressed life, and an overall need for change. As you look at your self-care choices and your decisions for where to focus your action plan, you'll want to think about where you are most feeling issues with a prior lack of self-care and prioritize the self-care strategies and goals that best support your personal and professional needs. BARNETT makes the point that awareness is key in considering self-care as a professional activity. Self-care includes daily self-reflection, weekly self-reflection, ongoing self-reflection, so that you know how you're feeling, how you're doing. As part of this self-reflection, you need to be honest with yourself about your stressors and how you are coping. Avoid the psychologist blind spot that BARNETT has pointed out, where we may think that because we're educated professionals, the problems apply to our clients rather than to ourselves. We need to get out our mirrors and look for where we are impacting our own lives by not having this sense of self-awareness. BARNETT also points out that we all have personal warning signs. These could be boredom, anger, daydreaming, wishing you were somewhere else, ending sessions early, arriving late, missing or canceling appointments, feeling fatigued, a loss of enjoyment, a low sense of motivation, impaired sleep, self-medicating. There are 100 million different ways that we may reflect our sense of burnout and exhaustion, and these are all personalized. Each person's warning signs are different. So know yourself, know the signs that say, I'm not taking good care of myself, and use those as a warning gauge to help you re-engage with your self-care, to help you connect with yourself, to notice that you need support, and then to move forward with the self-care that you need. As you consider self-care, remember to practice what you preach. The American Psychological Association Practice Center recommends that psychologists listen to what we offer to our clients. They offer a variety of strategies as reminders, refreshers of all the things we already know that we teach to our clients and our students, and that we need to remember to practice ourselves. We need to maintain an awareness of the stressors of our lives. This is going back to BARNETT's reminder that awareness is key. We need to use self-assessment, checking in, figuring out where we need help and support. We need to plan coping strategies for when challenges come. We should maintain participation in consultation, therapy, or treatment when needed. As professional caregivers, we still sometimes need professional care, and it's perfectly fine, absolutely reasonable and appropriate to go get the support, the consultation, the therapy, and the treatment to support yourself in being at your best personally and professionally. We need to remember our core health self-care strategies of sleep and exercise and diet. We need to make time to nurture meaningful relationships. We need to allow for leisure time, time off, vacations, weekends, evenings, time when we put away the smartphone, we turn off our computers, we put our files away, and we just relax and decompress. And we need to give a priority to our own mental and physical needs by developing and working towards specific goals. You may have professional goals, you may have personal goals. You need to give them a priority in your life, in your time, in your calendar. It's okay, it's appropriate, it's reasonable to say no to things that aren't on your priority list. And being aware and deliberate about what you say yes to and saying no to things that don't add value to your life or your career is a very important and key self-care strategy. Remember as well that social support is key. Social support often facilitates recovery or can be the source of recovery. McCormick et al. Pointed out in a study specifically about self-care among applied psychologists. Social support, you need to include the personal social support. This is your family and friends, your network of people who are there in your life to support you. And it also includes professional social support, having peers and colleagues and mentors whom you trust, with whom you can discuss workplace stress and turn to for support and encouragement and guidance about managing the balance of being a professional caregiver. As you look at your self-care needs, as you do an assessment of your self-care focus and begin to plan for your self-care goals, remember that a little bit every day is more effective than a lot every once in a while. Our best self-care plan is integrated into our daily lives, offering us support and recovery on a daily basis. It's wonderful to have a vacation once a year. It's wonderful to occasionally take a weekend off, but you need some time off to rest and recover every single day. You need some movement, some exercise or physical activity every day. You need healthy, nurturing foods every day. You need stress management and relaxation and recovery every single day. So as we plan a self-care intervention that fits your life, think about, how do I build this into my daily life? How can I do this every single day to support my ongoing wellness, my ongoing enjoyment and engagement with my life? And these brief interventions really can make a difference. Consider some research from exercise psychology that has shown, for instance, that a 30-minute stroll after a meal can improve blood glucose levels. And this study looked at individuals with diabetes and prediabetes, and it found that just going for a stroll after a meal supported the regulation of blood glucose levels. So these individuals did not do an extreme fitness program. They didn't train for marathons. They just went for a stroll every day after a meal and found that their blood glucose was more regulated. Another study found that for individuals with hypertension, 3 10-minute walks a day actually reduced blood pressure better than one 30-minute walk. So if you don't feel like right now you have time in your life to take a 30-minute walk, going for 3 10-minute walks can have a concrete physiological impact on your body. It can actually reduce blood pressure and help your body to maintain that lowered blood pressure, which has many, many physiological benefits. So 3 blocks of 10 minutes, a walk. Maybe you get to work 10 minutes early and you go for a 10-minute walk, or maybe mid-morning instead of a coffee break you take a 10-minute walk. And then after lunch, after you've eaten, but before you go back to your work, you take a little 10-minute walk, and then perhaps after dinner you walk with the dogs or stroll with your partner or with your child or with a dear friend or just with yourself to enjoy nature. You go out for just 10 minutes, and just those 3 10-minute walks, very small blocks of time, can improve your physical health. And you'll find they also improve your psychological health, and they'll give you a space that you're feeling cared for. Another brief intervention found that just 12 minutes of meditation a day reduced stress and actually lowered levels of inflammatory markers in the blood. And this is remarkable because it means that you don't have to find an hour a day to sit in meditation. You can just take 12 minutes to focus and breathe and meditate, and you will feel both the physical and psychological benefits of that effort. So don't underestimate the power of brief interventions. I know that as a professional caregiver, you are very, very busy, but you can find 3 10-minute blocks or 1 12-minute block. Start small, start focused, make it manageable and realistic and fit it into your schedule, and begin to take care of yourself. So the big question is, where do you start? What self-care activity should you begin with? And the thing that you should begin with is what matters most to you. You need to pick the lifestyle habit, the self-care task that feels most critical to your own well-being after this personalized assessment and review. Your goal is to find your why. Why do you want to improve your self-care? What matters to you? Why did you take this class in the first place? What are you trying to improve in your life? That why, that core answer, that deeper motivation is the thing that's going to help you commit, is the thing that's going to help you take care of yourself and succeed at being better with self-care. So what is your why? There are several supportive strategies that you can use as you both find your why and then stay committed to your why. And you may have used these with clients. You probably are familiar with these already. But as a refresher, consider a motivational list. Write down all of your reasons why. Perhaps as an example, you want to practice 15 minutes of yoga a day. Maybe you've heard that yoga improves flexibility and you want to be able to better get down on the floor with your children or your grandchildren or your pet, and you want to be able to better reach things from the top shelf. So write down all those reasons why you want to improve your strength and your flexibility. Make the list long and exhaustive, every single reason why you want to do this. But then, to keep you focused, perhaps consider a motivational word or a quote, something brief and specific that will keep you motivated, that when you wake up and you're feeling a little tired and you're not sure if you want to do it today, that will help you re-engage, re-spark. Get on your walking shoes or pull out your yoga mat or go have the cup of green tea. Whatever it is that you're going to do, come up with that motivational word or quote to support you when you need it. You might want to make a vision poster so that you can actually see your goal and outcome. Taking photographs, clipping things out from magazines, making a poster of what your goal and your outcome mean to you, of why you're staying committed. Again, this is much like the motivational list, but it's a visual reminder of all your reasons why. And for those of us who are more visual, a vision poster can be a very effective strategy to support you in remembering your why. You might also want to try a reward poster, the cousin to the vision poster. With the vision poster, you're seeing the goal and the outcome. With the reward poster, you're seeing the benefits of your goal and your outcome. Maybe you're walking daily because you want to go on a vacation that involves hiking. So you've got pictures of the place you want to go hiking. It's about the bigger, broader, long-term goals, the rewards that you'll get from staying motivated. And this is, again, a very visual reminder of your motivation for achieving this self-care. Or perhaps you have a playlist. If you're an auditory person, having a playlist of songs that reflect your goal and vision can help you stay on track, on target, and achieve your self-care goals. There may be other strategies, so jot down for yourself, what else would you suggest to your clients and your students? How would you help them both find their why and then stay focused and committed to that motivation? You'll need to also consider the ideal versus the real, because we live in the real world and life happens. So first, in the assignment you'll complete after this lecture, you're going to consider, what does your ideal self-care look like? In a perfect world, if you had all the time and resources, what would that ideal self-care look like? Have the blue sky, big picture thinking. What would it be if it was ideal? And then you'll want to consider, what are the obstacles, the real life situations, the responsibilities and complications that would prevent you from that ideal self-care? And then how can you address your obstacles and adjust your expectations so that you can build a self-care plan that fits your life? And I like you to start with ideal self-care, because sometimes we have this ideal vision and it doesn't really reflect us. It's something that we maybe inherited from a movie or the media or from some other person. So it's helpful to get that ideal down on paper so that then you can go, wait, that's not me. And then you can build a self-care plan that is you, that does fit your life, that reflects who you are and what you want and what you feel comfortable doing. If your ideal self-care plan is going dancing every week, and in your regular life you don't like crowds or noise or other people, perhaps that ideal self-care isn't really you. Maybe that's something you got from someone else or somewhere else. So what does self-care look like for your life, for the real you, for what you really truly enjoy and want and feel? You'll want to spend some time on overcoming obstacles. You'll need to jot down and consider, what barriers and roadblocks will you face in implementing your self-care plan? And then, how would you coach your students and your clients to address those barriers? I am sure you have a wide variety of strategies that you would teach to your clients and support them in addressing their barriers. Some strategies that you might want to consider are, of course, contingency planning. Writing down, making a list of what your barriers are and how you will address them. Build routines, because consistency matters. If you build in that every day after your lunch period you go for a 10-minute walk, that will become your routine. It will be built into what you do, and it will be easier to consistently do it. So figure out how to build your self-care plan in a way that you can build it into your routine for consistency, because that will support your success. Break down goals into sub-goals. Find specific, concrete, small things that you can do now so that you experience success, so that you experience the benefits of taking better care of yourself. And that will help you with long-term goals. And consider accountability partners. We've already talked about the importance of social support, but when you're looking at self-care in particular, having an accountability partner can help you achieve your goal. Maybe you find a good friend and you go for a walk together every day after lunch, because then it's not just that you're getting used to the walk, it's that you're doing it with your friend. You have that additional social support. You're committed to them as well. Maybe 3 times a week you meet a good friend at a meditation class or a yoga class. And so again, you're connecting, you're committing, you're supporting their well-being, they're supporting your well-being. Perhaps you have a friend who lives far away and you're not meeting somewhere physically, but you're both committing to spend 12 minutes a day in meditation. And after you do so, you text each other and say that you've done your meditation and this is how you felt and what did they do. It's just part of knowing that someone is supporting your self-care and you are supporting someone else's self-care, and that social support together can help you both achieve your goals. As you complete the course, I'm going to ask you to set a self-care goal. I want you to pick something concrete, simple, and brief. And I want you to write it down, say it out loud, absolutely commit to it. For the next 6 weeks, I will. You will do it, and you'll do it every day for the next 6 weeks to commit to it. Make it something small, make it concrete, make it simple, make it brief. Use a brief self-care intervention that connects to your why, to your personalized assessment. What do you want to feel better about? How do you want to better support yourself? What change is going to be the thing where you feel a difference? Maybe it's one of the mindfulness strategies that we learned and you do it every day. Maybe it's mindfully brushing your teeth every day. Maybe it's going for a walk every day. Maybe it's having a salad every night for dinner. You came to this course talking about mindfulness and to learn about mindfulness as self-care. But it's fine if you pick a non-mindful self-care goal. I just want you to pick something to care for yourself, to nurture yourself, and commit to doing it for every day for the next 6 weeks to make it a habit, a daily part of your life, so that self-care is integrated into your daily routine. It has been an absolute honor and privilege to have you take this mindful self-care journey with me. I hope that you truly commit to finding some time to caring for yourself over the next 6 weeks. I hope you make time to nurture your soul, your heart, your well-being, and to care for yourself. I wish you all the best on the journey. If you have questions along the way, please feel free to reach out to me. And I hope that in 6 weeks I will hear from you and you'll let me know about your success. I wish you all the self-care and good care for the rest of your life.
Thank you for joining me to learn more about mindfulness research and best practices. If you like my content, please subscribe to my channel to stay updated for new videos. I'll see you next time.